The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
And welcome to Project Independence and You Community Talk Radio on 88.1 FM and WCWP.org. I am your producer / co-host today, Kristina Lou, and my co-host, of course, is the fabulous Otto Lohse. And we are talking with Dr. Seymour Huberfeld, who is a pulmonologist and critical care medicine specialist over at Northwell Health Physician Partners, Pulmonary and Sleep Medicine. Quite the mouthful there, Dr. Huberfeld. Welcome to our show. We are excited to have you on because we are talking about the importance of sleep. You should know, Dr. Huberfeld, for weeks to come, we've been promoting this segment on the show, and we are always talking about sleep and mostly lack of sleep and how to optimize sleep. So we are excited to really dive in and have you on. So welcome.
Thank you. Thank you so much. I've been looking forward to this as well.
Great.
Okay.
So, Otto, I'm sure you have a long list of questions.
Actually, I do.
There you go. He's always very prepared, Dr. Huberfeld.
Good.
Well, a place to start, actually, is that I was very interested in the idea that you now have the ability to do home sleep testing. And yeah. I've had family members who've gone to sleep centers, and I've never done it, but it doesn't sound very comfortable to have to go somewhere and kind of force your sleep.
Well, if I could describe what going for a laboratory sleep study involves, as opposed to doing a sleep test at home, that might be a good way of dealing.
Perfect. I think it's a good way to start.
So, yeah. The traditional laboratory sleep study, and there are different versions of this, is something called a polysomnogram. Poly meaning multiple, somno meaning sleep, and gram is sort of a test, long word. Okay, so during this, you're assessing many things. The first thing you want to do is you want to assess sleep. So in order to assess sleep, you need to have brainwave activity, because brainwave activity is how we know when people are in sleep. Okay, and you also, with that includes assessment of eye movements. For example, you may have heard the term REM sleep. REM stands for rapid eye movement. So the eyes are flitting around during REM sleep. If I can go tangentially for a moment, one of the fathers of sleep medicine, who actually recently passed away, was Dr. Dement. Dr. Dement was studying sleep, and he didn't have all the fancy equipment we have. This was in the 1950s. So the way he was studying sleep is when he was an intern, he was watching the patients sleep. So he was going out to their bedside and essentially seeing their eyes moving at times during sleep. And the problem was that one of the patients woke up and found this doctor in their face. So he almost got thrown out of the program, and sleep medicine would have been basically never happened if it wasn't for this. But someone came to his defense and understood that he was really a pure scientist, and he described REM sleep. So anyway, we're getting back to the polysomnogram. So you have brainwave activity, which is electrodes on the scalp. You have eye movements, okay? Then you have to have something about breathing. We're looking for sleep apnea. So you have a belt on the chest and a belt on the belly, and you have a finger probe to measure the oxygen levels. You have an EKG lead on to look for heart rate issues and EKG issues. You have a muscle probe on. So all in all, you have about 16 wires on the body. So here you are checking into a foreign place, hotel room, usually 3 stars, cable TV, nothing fancy. Clean, slightly better than Motel 6. And and they say, okay, with all this, they say, go to sleep. Now, that can be a little bit of an intimidating problem. Now, if you have a sleep disorder and you are pathologically sleepy, you say, we would take the attitude, okay, if you can't sleep in the sleep lab, you probably don't have a sleep problem. Okay. That works very well for disorders of excessive sleepiness. Doesn't work great for insomnia problems. If you want to assess an insomniac, that's not a great way to do that. So in fact, for research purposes, they would actually have people get wired up for like a week to get you used to it and then study you. I can't imagine your typical insurance company approving a week-long sleep study.
Yeah, I don't think so.
So that's what a laboratory sleep study involves. It's very detailed. You get very precise measurements of sleep time, breathing, apnea, oxygen levels. It's very detailed, but it's also very artificial. So that's why whenever possible, we will study people at home. Now, you can't expect to do a 16-channel sleep study at home. Something is going to go wrong. And there were companies that used to do that. They would send a technician to the house, 16 wires at home. And I never really got into that. In general, home sleep tests, and I will divide that now into home sleep tests and home sleep apnea tests, are simpler. They don't do everything that the laboratory test does. But I asked the question, do you always need all the information that the laboratory test is going to give you? Do you need to be that precise? Does it change the information if you don't know down to the moment exactly how long the patient slept, or if you have an approximation? And the home tests are getting better and better. We've been doing home tests now for about 12 years, and we're very, very happy with them. And it's been a revolution for us because many, many more people are getting assessed and getting tested and getting their sleep looked at.
I wear a Fitbit, and the Fitbit thing tells you, and I'm asking basically the accuracy. It breaks the thing down by light sleep, REM, awake, deep.
Okay. What an excellent question. And the answer to that question is, I wish I knew. So the problem with and not just Fitbit, it's Apple and all these.
Yeah, there's so many different products.
They use what are called proprietary algorithms, meaning if you ask me, how does the Fitbit know what stage of sleep you're in? The answer is, I don't know, and they won't tell me. There are actually to the point where there are studies that are done that are trying to correlate Fitbit data with sleep test data. So I would tell you that as a rough idea, if you're a healthy person with relatively normal sleep, then the Fitbit is a good thing to use. But if you're trying to assess someone with a sleep disorder, I don't think I would rely on it. Interesting, I will tell you that just this past week, I had a patient who came to see me. It says, well, I think I have sleep apnea because my watch is telling me my oxygen levels are going down at night. And that was their chief complaint. They came in because of their Fitbit. So if that, or in this case, their Apple Watch. So if it gets people to get tested for their sleep, I'm all in favor. But it's interesting, but I will tell you that wearables, I think, are part of our sleep future. I think it's part of what we will be doing as the technology improves and can become reliable. I think it's definitely part of what we will be doing.
It's interesting because like a Fitbit I'll use because that's what I use. It gives you a rating, what your sleep is, like 86 or whatever. And the interesting thing is when I look at that thing, it does correlate with how I feel about the sleep I had. If I had bad sleep, the number is low. It feels like I had bad sleep. Let's put it that way.
Okay. So are you any wiser because of it?
I doubt it. One thing it does say, like the deep sleep, I find that when it says, maybe it's mental approach to the whole thing. When the deep sleep number looks higher, I feel like I slept better,
It could be psychological too, right?
So which is the cause and which is the effect?
Yeah.
Are you feeling better because your watch said you slept better, or are you feeling better because you actually slept better?
I don't know. I don't know
either. Good question.
We're just gonna have to see where the technology takes us on this.
Correct.
On this
but it is where the technology is going. Okay. That is definitely where the technology is going.
And I think, Dr. Huberfeld, let's even back it up. So what usually brings someone to you? Is it mostly, just, oh my God, I can't sleep, or I'm always tired? What would prompt someone to have to get into getting a sleep study?
Okay. So there are a few different reasons. And one is the complaint that I sleep and I'm still tired. I go to sleep, And it doesn't matter how long I sleep. I sleep 5 hours, 6 hours, 7 hours, 10 hours. I'm still tired. I'm fine when I'm okay. But, when I drive, I'm getting groggy. I'm falling asleep in front of the TV. That's one typical complaint. Along with that is my spouse says I stop breathing at night. Gets people in. Or my wife is kicking me out of the bedroom. I had that one this morning, in fact. I said, my wife threw me out of the bedroom because I'm snoring too loud. You get a lot of those. But then you also have the people who say, listen, I just can't sleep. I can't stay asleep. I'm up all night. I'm walking around. So the I can't sleep problem. So that's another side of it. Those are the two main reasons. And there are many others, of course. I mean, people who come in with the more unusual sleep problems, the people, they say they're walking around, they're falling out of bed, those kind of sleep issues. Those are the different ones. Okay.
Many years ago, like in my lifetime, I probably had all the sleep issues that go on. And many years ago, I was on some medication. I don't even remember what it was anymore. But I remember waking up in the middle of the night and getting my wife out of bed and dancing. I was basically hallucinating. And I talked to my internist at the time, and I do not remember, this was a long time ago, but she took me off this particular medication and I stopped dancing in my sleep. Like medication, I guess, can cause some issues.
Okay, so what you're talking about, I'm guessing, and again, a lot of this is interesting because a lot of these diagnoses we make simply by talking to people, getting the story. So we've all heard of something called sleepwalking, right? Many of us have observed our children sleepwalk. I've never seen my kids sleepwalk, but I remember seeing it. I remember probably the first experience I had with sleepwalking was as a counselor in sleepaway camp. Seeing a camper literally get out of bed, walking around, going to the bathroom and being in this sort of like semi-awake state and asking them in the morning. And by the way, no, I did not become a sleep doctor from that event. I'm just asking, do you remember this? And they had no memory whatsoever of this. So sleepwalking, although it can occur in adults, is generally a children's thing. But there's something else called Rem Behavior Disorder, which may be what you had. So let me describe Rem Behavior Disorder. So during, I mentioned before REM sleep. So during REM sleep, dream sleep, your brain is on and it's like watching a movie in your head, and but the body is protected. There's basically a switch that turns off your voluntary muscles. The only muscles that are working are your eyes and your breathing muscles. So during REM behavior disorder, that switch in your brain stops working so well, so you can start engaging in some sort of a behavior at night. It's usually sort of less purposeful than you're describing, but sometimes people will fall out of bed, they'll walk around the room. The problem is that they're attending to the movie in their head. They're not seeing what's in front of them. So they'll fall down, they'll get hurt, they'll fall out of bed, they'll injure themselves. So it might have been that, and that can sometimes be precipitated by antidepressant medications. But that's not the only thing. There were other things that could be. How many years ago was this?
Oh, God. 55.
So this is well before cell phone cameras.
Yes. Oh, yeah.
With cell phone cameras, by the way, just going back to the idea of patients helping out, cell phone cameras have changed this, because a lot of times, your patient's describing things, but not exactly. But the fact that someone will, take a video, oh, wow, that's great. Let's look at that,
Yeah.
Yeah, well, this is great. Like, what we say, that's the benefits of technology.
Invariably, you put them in the sleep lab and it doesn't happen.
Mm-hmm.
Well, you mentioned the first one on the list was get sleep and be tired. What's typically the scenario that goes around that? Why would that happen, and what can be done to help it?
The number one cause of I sleep and I'm still tired is insufficient sleep. Okay, how much sleep do people need?
I don't know.
Okay.
7 hours, 8 hours.
We always say this magic number, 8 hours, right? This magic 8-hour number. Okay. So I can't exactly give you the source of the 8-hour number, but I will mention that the medieval physician Maimonides mentioned 8 hours, but I don't think he made it up either. I think he probably got it from other physicians before him. But 8 hours is probably an average rather than a number. So here's an interesting observation. Do you remember Hurricane Sandy?
Yes.
Okay. Did you lose power during Hurricane Sandy?
Yes.
I did not actually.
You did not. Okay. So this was an observation that people told me after Hurricane Sandy. People who had no power in the houses. That, you know, remember how Hurricane Sandy, if I remember correctly, was in November. It was right after we changed the clock, and it was getting dark about 5 o'clock. So people were saying, you know, by 8 o'clock, I was in bed. Why is that? Who goes to bed at 8 o'clock? The answer is, well, before we had electricity, we all went to bed when it got dark. When we worked during the day, and at night we went to sleep. And in the wintertime, people slept a very long time. People slept way longer than the magic 8 hours. Probably in the summertime, they slept less. So how much sleep do you need? Well, it's really how much sleep can you get? So if you free reign, which is you don't use an alarm clock, and you go to bed when you're tired, and you wake up in the morning when you're rested, your body will tell you how much sleep you need. Some people need 6, some people need 10. Now, if you are a 10-hour sleeper and you give your body 7, you're going to be tired. But say, what's wrong with me? I only need 7 hours of sleep. I had 7 hours of sleep. What's wrong with you? The answer is your body wants more, you know? So you have to, the only way to know is to basically give your body a chance to figure it out. So the number one complaint is not getting enough sleep. And this is a very common problem. We have, what do? We turn night into day. We have lights. We have all of our entertainments. We all have so many things we want to do. We all have Facebook that we want to check. We all have emails that we still want to send. So none of...
Dr. Huberfeld, I think you might be in my house. You were straight up in my mind, right? you just did a whole list of everything I need to do.
Right. We all have so much we want to do.
That's right. We're going to take a short break, though, and we are going to come right back with Dr. Huberfeld talking about sleep. This is Project Independence and You on 88.1 FM and WCWP.org. We'll be right back.
So I get this call from my grandma, and she's like,
"What's a podcast, and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to WCWP.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios Podcasts, available on any podcast app. You know, those little button things on your phone screen. Just ask your grandkids.
And welcome back to Project Independence and You Community Talk Radio on 88.1 FM and WCWP.org. We are diving right back in with Dr. Huberfeld, talking about all things involving sleep and lack of sleep, and it's such a complex issue, and I think Otto had a good point. He tried to bring it up during the break, but we said hold that thought, because everyone, there is that magic 8-hour number, and you feel somewhat you failed if you didn't get that 8 hours.
No.
Lying in bed, and that's the thing is, Otto had a great point. Yes, I might be lying in bed for 8 hours, but am I actually sleeping for 8 hours?
Okay. Get just to finish up the previous point, which was the, sleep deprivation, not getting enough sleep. Okay. So the way to get to know how much sleep you need is to give your body the sleep at once. That's how you know. Do all the things that get rid of the things that distract us from sleeping, which is, make our to-do list perhaps a little bit shorter. And by the way, when I say all these things, I'm talking to myself as much as I'm just as guilty as everybody else. So don't think I don't know too many doctors who get 8 hours sleep a night. Just don't. Try to shorten your to-do list a little bit, drink a little bit less coffee, and give yourself the time to sleep. Just getting back, by the way, I mentioned earlier the famous Maimonides, the medieval physician. He also didn't get 8 hours sleep. It talks about the fact he used to get home at 11 o'clock at night and then to a house full of patients. So So we're just as bad at this as everybody else is. But getting back to this, so we were talking about the complaint of non-restorative sleep. So the second most common cause of non-restorative sleep is sleep apnea. Mm-hmm. And their estimate is that there are 40 million Americans with sleep apnea. And that number is only growing as, unfortunately, our population is growing wider because obesity contributes to sleep apnea. So more and more people are diagnosed with sleep apnea, but the vast majority are undiagnosed. So
what is a kindergarten explanation of what apnea is?
Well, the word apnea means not breathing, and sleep apnea means basically not breathing at night or inadequate breathing at night. Sleep apnea is a breathing disorder where people block their airway intermittently during the night, such that their sleep is not continuous. It's disrupted and fragmented. Instead of sleeping continually, their sleep has all these interruptions and arousals because they block their airway. And that is, frankly, when we do a home sleep test, that's what we're looking for, because it's an important medical condition, because it leads to blood pressure problems and cardiovascular problems and stroke problems, and motor vehicle accidents, and a loss of quality of life. So that is they might say the second most common cause of, as I say, non-restorative sleep. There are other causes of non-restorative sleep. For example, medications are a very common cause of non-restorative sleep. I'm not going to ask Otto what you take, but I would ask, how many medications do you think the average person your age takes?
Well, I'll tell you what I take, and I'm going to tell you a story about it. I take a blood pressure medication, and I take a cholesterol medication. And I had a stretch maybe a year ago where I'm taking statin, and the statin, all of a sudden, every joint in my body was hurting. Mm-hmm. And I would wake up in the middle of the night and take an Advil or whatever, and no matter what I did, it would hurt. So I look up Dr. Google myself, and I look and I see statin can cause joint pains. So I speak to my doctor and conclude that I should go from 80 milligrams of Pravachol down to 40 milligrams. And I swear to you, within a day or two, all my joint pains went away. Now, is my cholesterol up? I don't know. I haven't gone back, but I will. But that's just an example. But anyhow, answering the question, that's what I take.
Right. And so, but the average person, I would say, without knowing the exact data on it, it wouldn't surprise me that the average person who is, let's say, 75 plus takes about 7 or 8 medicines, mm-hmm. and at least one of them will have some effect on sleep. Either it will interrupt sleep, or it'll make them tired, or has a side effect of sleep. So medications are a very, very important issue to deal with when it comes to sleep. And once let's say you tackle, let's say not getting enough sleep, dealing with sleep apnea, dealing with medications, that takes care of a large chunk of the issues. Then you have medical problems that cause which have sleepiness as part of the disease. There are conditions to do that, like some neurological disease, where a sleep disorder is inherently part of it. Things like MS or Parkinson's disease, where sleep is a symptom of a larger problem. And then you'll get to stranger diseases, the more esoteric, fascinating sleep problems that the sleep doctors love to talk about. We don't get to see as much as we'd like, but they're there, and then you have to, and if you don't look for them, you don't find them.
Well, neuropathy is, my wife has neuropathy in her feet, and it's not from diabetes, but it interrupts her sleep.
Well, but for example, some of the medications that are given for neuropathy cause a side effect, sleepiness.
Yes.
But, and by the way, sometimes they actually help people sleep.
Yes.
Right. Because if you treat the neuropathy, you'll sleep better.
As far as the sleep part goes, stuffy nose, I get a stuffy nose all the time. Have to go to the bathroom. So the 8 hours is interrupted by things like that. And I'm not sure what you can do about the bathroom part, unless you take medication, which has its side effects.
Well, let's go to the bathroom issue. Okay, so you mentioned, Kristina, you mentioned how patients come to me.
Mm-hmm.
The one source of patients to me are actually urologists. Okay, so this is, I'm getting up at night to urinate. Okay, are you actually getting up at night to urinate, or are you urinating because you're awake? So I tell the story, this is the typical story. The 35-year-old physician who's on call at night, gets a call in the middle of the night, is on the phone for 5 minutes, and then needs to visit the men's room in the middle of the night. They don't have a prostate disorder. Their sleep is disrupted by their phone. That's the problem. So, because normally it's not uncommon. We go to the restroom maybe every 3 or 4 hours, but during the night we sleep because, again, our ability to sense our bladder is reduced because we're asleep. But if you wake the person up, that's where they're heading. So the urologist is faced with a patient who doesn't seem to have such a bad problem. And the patient says, well, I'm getting up 3 times a night to go to the bathroom. But I said, but nothing's that bad. The smart urologists say, well, maybe we should check your sleep. And I get at least 2 or 3 patients like this a month. And I used to be able to say, I can tell which of them has a prostate problem and which of them has a sleep problem without doing a sleep test. I am uniformly wrong. So I test them and I see, and sometimes I will see they have a sleep disorder, and it's their sleep disorder that's either causing or exacerbating the problem. And so that overlap between, let's say, sleep apnea and urological problems has become very common in the. I have a whole cadre of urologists that wisely send their patients for sleep tests before operating.
Yeah.
Like when I had that joint stuff going on, I would take an occasional Advil. I'm not big on taking what I don't have to take, but when I took the Advil, I didn't have to get up to go to the bathroom either.
Right. So exactly that. So think about that. You took the Advil because it wasn't the prostate that was waking you up; it was the pain that was waking you up. But the symptom was, I'm going to the bathroom.
Yeah.
Right. It makes so much. I never thought of it that way. But it makes so much sense because it's the minute I wake up, it's like, oh, I have to go. But that's not what's waking me up. It's just, now I'm up, and that's kind of like a habitual thing.
So this is interesting. So, once I started practicing sleep medicine, you mentioned I was a pulmonary critical care and sleep medicine. You think of everything through the sleep lens. Mm-hmm. All of it. Usually we don't think of medical problems in that sleep idea, but I think sleep. 1/3 of our lives is spent sleeping. So you have to think of almost anything in medicine within the sleep context. So it gives you great insight into all of the whole larger medicine picture.
The other one that happens to me is you wake up, and I'm sure we go through this, with some really brilliant ideas. They hit you and you say, I don't want to forget that. So then I think about this ideas or multiple ideas over and over again, and therefore I'm not sleeping. So what I have started to do is I literally, which you shouldn't do, but I do, I take the cell phone and I send myself an email with these brilliant thoughts, and then I'm able to go back to sleep.
Okay, so can I ask you a question?
Sure.
What's wrong with a pencil and a Post-it note?
I did do that up until I had the phone.
So I understand that. So the problem with the phone is that once you have the phone in your hand, you're going to see the 7 text messages that are waiting for you and the 3 interesting emails. Oh, and this great video you just got on WhatsApp. And before you know it, you've wasted an hour on the phone. Furthermore, the phone itself, the light that it gives off tends to be very alerting. Mm-hmm. And this leads to a bad habit. If you make a habit of engaging your brain during the night, it becomes part of you. I read a number of years ago, there was apparently a very common practice during the long winter nights for people to get up in the middle of the night and read or write, because the nights were 10, 11, 12 hours long. They didn't sleep all that time. They would go to sleep early. In the middle of the night, they would do some work. That became part of a normal routine. But we don't really want that as part of our normal routine. So if you engage in sort of this constructive behavior during the night, it ends up being, in a way, counterproductive. Either it interferes with your sleep, this becomes a conditioned response. People often they'll tell me when they're frustrated from insomnia, they go to their computer, they start doing their taxes, they start doing things. I said, did you ever look back at the work you did in the middle of the night? You'll find it's filled with errors, it's filled with mistakes. That's not what you should do. Don't try to. I don't want to waste the time. Yeah. That's not wasted time. This is downtime. Your body is asking for it. Give your body the downtime that it wants.
Well, that's interesting because I've always had this habit. I used to have a thing on the night table, pre-cell phone. I forget what it was called, jog a note or something.
Right.
That had a pen in it. You pull the pen out and a little light would go on and you'd write on the pad.
Okay. Otto, I want you to invent something. I get all my best ideas in the shower. What am I supposed to do then? I don't have the cell phone. I don't have a pen. I don't have a pad. I need to get a notepad for the shower.
We'll have to get you some kind of waterproof notepad.
All my best ideas are in the
I got an answer for you. You need an Alexa in the bathroom.
That's right. You can have Alexa record the information. There you go. But you know what I saw, Dr. Huberfeld, in just this conversation, and listen, I'm full disclosure, I am like the worst. I'm quite the night owl. I get all my stuff. I come from work, and then it's like I have 10,000 things I'm doing at nighttime when like the house is quiet, and you can get that done. So it's something that I'm constantly trying to, work on, obviously, myself. And then, in reading and preparing for this interview, I saw this quote in one of the articles on Northwell's site, and it was just, sleep is the only time your body is able to focus almost exclusively on repairing and restoring itself. And I think that it just struck me because it's just back to what you were saying and the fact that, people look at sleep like, oh, I'll sleep when I'm dead. It's wasted time. It's all these things you hear, and not realizing that it's such an important function to, it's not, if you sleep too much, you're not wasting time. It's, you're actually healing your body, which is, impacts everything else, which I thought was just so interesting.
I'll take that a step further. So, as I mentioned before, one of the conditions that I treat commonly is this condition called sleep apnea. So, as I said, sometimes people come to me for sleep apnea for the complaint of non-restorative sleep, or the urologist, or the spouse, or whatever. But one of the reasons we test people for sleep apnea is a complaint of shortness of breath. And I never quite understood that. I said, okay, I know it's true. I never understood it. And recently I read an article about how if they would deliberately sleep deprive people and then take them to the gym in the morning, that they couldn't exercise to the same extent. If you go to the gym, if you've done an all-nighter, you won't be able to exercise to that extent. Why? Because your body simply needs the chance to recharge, to rebuild, and get going for the next day. So yes, that's why sleep was invented. That's why God created sleep. Animals sleep, fish sleep. We need this.
So now you just described something, all right? You wake up and you're tired. So then eventually you may wind up taking a nap. I'm a napper. I can take a 15, 20-minute nap, what I call a power nap.
Yeah.
And it helps a lot during the day. Now, what does that do to me overall, though? That's the question.
You just read my mind, Otto. I was going in the same place about naps.
Okay. I don't know. I the more I hear about Otto, the more I want to see him as a patient. But I think it's
I'm bearing my soul.
Let's talk about napping. Okay, let's talk about napping.
Yes.
So, first of all, one of the important questions I ask people is, are your naps restorative? Do you feel better after a nap? You would think you should feel better after a nap, right? Well, typically sleep apnea patients don't feel better after a nap because their sleep is inherently non-restorative. They feel worse after a nap. They feel groggy. They feel achy. They don't like, they have no choice. They nap unintentionally, but they don't feel good afterwards. So who feels good after a nap? Well, first of all, people who are chronically sleep deprived feel good after a nap. Okay. They're not getting enough sleep. Okay. People who are maybe on medication will feel better after a nap. Who else? There is a condition called narcolepsy. So narcolepsy is People use the term narcolepsy as a sort of descriptive for being very tired, but in the medical context, narcolepsy is a pathological disorder of alertness. It's a pathological disorder where people's sleep basically does not do what it's supposed to do because there's a problem with a brain hormone, they're missing a brain hormone, and one of their typical symptoms are these incredibly restorative naps, meaning they'll go to work at 8 o'clock in the morning, they'll work for 2 hours, and they literally need to stop. They have to stop and lie down for 10 minutes, and after 10 minutes, they're right as rain for another 3 hours, and then they have to do it again. It's part of the condition. And in fact, one of the treatments is scheduled napping. We tell them, okay, this is the way you're going to work. You're going to work for a few hours. You're going to get a couch in your office. You're going to lie down for 15 minutes, and you're going to feel great when you do that because you need that. Okay. So if someone needs to nap, it needs to, I'm not saying they have a problem, but it should be investigated. Now let's parlay that to a different issue, which is the napping culture. So we the American culture does not allow napping, right? It's a bad idea. We work through lunch, we work through that siesta time, but there are many cultures that have a natural siesta time. Why is that? Because there is a natural tendency to be a little sleepy in the middle of the day. It's there. Kids get a nap in school time. Preschoolers get a nap at that time. And there's a natural tendency to have that little nap in the middle of the day. Most of us can work through it, but it's not the worst thing in the world. We're moving away from that culturally, but many cultures still have it. They work later. They divide their 8 hours into maybe 2 and 6 or 1 and 7.
See, I feel better after
Me too.
A nap.
I love a good nap.
516-3260.
But I've always had that ability. I was in the Navy. I was in boot camp, 19 years old, and I'm on guard duty watching a scrub house where you had to do your laundry by hand. And I'm standing there at midnight with a fake rifle, and I'm leaning on the fake rifle, and all of a sudden, my eyes are closed. I'm standing, but I'm sleeping. And along comes the officer of the day, and he kicks my fake rifle away, and he says, what's the first order or whatever? I don't remember all the details, but don't fall asleep on your post, all right? Well, I was asleep on my post standing up. So I've always had the ability to take a nap if I felt tired. And I do feel better after I take the nap, but maybe I should call you.
Otto, we might have to get, twin beds next
Maybe we should do a follow-up.
But guys, we are going to go to another break. This is such a wonderful interview. We will be back with Dr. Huberfeld on Project Independence and You Community Talk Radio here on 88.1 FM and WCWP.org.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
And welcome back to Project Independence and You on Community Talk Radio on 88.1 FM and WCWP.org. We are back here with Dr. Seymour Huberfeld talking about the importance of sleep and just all things sleep. And, I think I have like a whole notepad. You guys should only see my table right now and everything I'm writing down. So we have a lot to cover. This is our last segment. We cannot believe it. So let's just dive back in. We had touched upon this earlier, and it was about the issue of, okay, I'm going to get my 8 hours. I always have great intentions. I'm going to get my 8 hours. I get into my bed, and I'm lying there. And please, the minute I close my eyes, the thoughts and the turning, everything that's going on inside my brain, I'm not actually sleeping. I'm always curious to know at what point I actually fell asleep. So let's just dive into that. What do we do? What does this mean?
Okay.
Everything.
So we could talk about this from two perspectives. So first perspective I want to talk about, which is how to get to sleep. Okay. So people think of their body like their car. I'm going to drive my car, 20 miles an hour over the speed limit. make that sharp left turn into my driveway, throw the car in park, turn off the ignition, and the car is going to stop. So that's what they're doing with their sleep. They're going full tilt all the way, emails, cell phones, exercise. It's 11. I got to get my 11. It's 5 minutes to 11. I got my 8 hours sleep. So they throw off their clothes, they jump into bed, and they pull the blanket on, turn the light off, and think they're going to go to sleep. Doesn't quite work like that. You can't ask that of your body. You can't go from full on to full off. You have to have downtime. Okay. I mean, what do we teach our kids? Okay. The kids have playtime. Then they say, okay, time to get ready for bed. They take a bath, they brush their teeth, they say their prayers, you read them a bedtime story, and they go to sleep. And then we spend our adult lives unlearning that simple lesson. We unlearn what we all know, what we teach our kids, and we don't do that. So you have to realize that you can't just do that. You can't, some people can. They probably have a sleep disorder. They're probably pathologically sleeping, but most normal people can't do that. They have to do something to power down, to get ready for sleep, turn off their cell phone, finish up. The day has an end. Tomorrow is another day, and get ready, whether it's going to read a book, speak with your spouse. Always a good idea to speak a little bit with your spouse and go, think about, talk, get the day, get into a more relaxed mode, trying not to use television to get ready for bed, but it's not the worst thing in the world. I've seen a lot worse things. And then you can try to power down and maybe go to sleep. So that's one important aspect of just getting to sleep, is that getting ready for sleep, getting into a more relaxed state so you can get that sleep. So that's one part of it. The other issue is that when people say they're in bed and they can't sleep, okay, what do you think's actually happening? And this goes back to something we talked about in the first segment, which is studying sleep. So the problem is, if I take a typical patient with insomnia and I put them in the sleep lab, they may have an extremely negative experience because they can't sleep in that environment. So recently, we started studying sleep with a very, very small device. It's not quite as small as the Fitbit, but it's basically a small device that measures brainwave activity. And what we were able to see is very often when people just don't really assess the number of hours of sleep that they have accurately. We call this sleep stage misperception. So here's an example. So one of the most popular sleep aids out there is a drug called Ambien, right? Lots of people take Ambien. And they say, wow, if I take my Ambien, I sleep. If I don't take my Ambien, I don't sleep. If you actually look and measure how much more sleep you get from a drug like Ambien, it's maybe 30, 35 extra minutes. What you have is fewer interruptions. Because what happens is you wake up, it's 2:00. Then you wake up, it's 2:15. Then you wake up, it's 2:30. And you think you've been awake that entire time. The reality is you've actually been asleep in between. I love this story. I tell this a few times. So I remember, unfortunately, during COVID, I spent a lot of time working in the hospital. And it was a very, very stressful time. And I was not sleeping. And, my wife wasn't sleeping either at that time. I remember having a conversation once at about 4:00 in the morning. And we chatting, said, okay, I need to be up in an hour and a half. I'm going to try to go back to sleep. And I'm lying in bed, and I promise you I'm awake. I'm wide awake. I'm thinking. Then my alarm goes off. And I said, okay, I got it. Okay. And my wife says, well, at least you got back to sleep for an hour. I said, what are you talking about? He said, well, you've been snoring for the last hour straight. This is a classic example. I was sure. I would have sworn I was wide awake. The reality I was micro sleeping. I was in and out, but I was sleeping. So it wasn't a great quality sleep, but I was actually asleep. So this is sleep stage misperception. So this, you had asked me, Kristina, about pills, melatonin, drugs. So what drugs often do is they make the sleep slightly deeper, so it's slightly less interrupted, but they don't really do that much. That's why we try very hard to stay away from medications for sleep as much as possible, because they often do much more harm than good.
Yeah, because that's what I mean, certainly with, the more heavy medications. I mean, the side effects alone, I've seen so many interviews with people talking about, what, happens, and then that melatonin, it's, it's just every commercial you flip through, they'll see, the wonders of melatonin and to give melatonin to your children. I mean, there's all these things you see now. So I'm always curious to know.
Well, first of all, I wouldn't give anything to children for sleep. Yeah. Children can, have you ever, none of us sleep like our kids sleep. Kids sleep. Yeah. Kids sleep. I don't know why. We all want to get back to sleep the way our kids do. So I'd be very reluctant to give anything to children. Mm-hmm. Now, there is a group of patients that often benefit from melatonin. That's older patients, because older patients may have a little bit of a deficiency of melatonin. But what is melatonin? Let's talk about it.
Yes.
Melatonin is actually a hormone made by a gland in the brain called the pineal gland. And it is basically a controller of the sleep-wake cycle. It basically tells your brain where night and day is. If you go back in medieval times, you used to think of the pineal gland as the third eye, because it's sensitive to light. So those of us who spend their majority of their time inside may have some impact on their melatonin cycling. So by taking melatonin at bed, it's sort of like telling the body it's nighttime. It's sort of like counteracting all the bad habits we were doing before. So it might say it's sort of like a signal, okay, it's time to go to sleep. So that's what the melatonin gives you. It's like a little signal that it's time to go to sleep. But it's not, if you just take it in very small doses, it's not a sleeping pill. Now, if you look at a melatonin product, you'll see anywhere from melatonin from 1 milligram to 4 milligrams, to 10 milligrams. At some point in time, it becomes a sleeping pill. So generally speaking, I would tell people, if you want to take a very small dose of melatonin at bedtime, like a milligram or 2, I don't really have an objection, but you should stay away from the higher doses because it just becomes a sleeping pill. And then it gets part of this idea that you need something to go to sleep. And it's never a good idea to need something to go to sleep because it becomes part of the routine. It becomes what you become dependent on, not the drug, but you become dependent on something to get you to sleep, which you never want.
Well, products like melatonin are super marketing people. There's thousands of them on the internet.
Right. That's what
by the way, and how much melatonin do they actually have?
I have no idea.
Neither do I.
Yeah.
Okay.
That's because they're not a regulated product. You really never know exactly what you're getting in them.
Interesting.
Yeah, it's complicated. I know
it is. No, because you see all these things, and everyone's, oh, that sounds great. Oh, it's it's marketed as natural. So it's not like the same category as an Ambien. I mean, this is how
right. It's not. It's not. You don't need a prescription for it. It's hard to hurt yourself with it, but you could, and you're not going to get addicted to melatonin per se, but you might get dependent on the concept of taking something to sleep.
And that's what I think a lot of it, has to do with it. It becomes this habitual, part of your routine.
Exactly.
You mentioned Ambien.
It becomes part of the routine. It becomes part of what you need to do to go to sleep.
Right.
Well, you mentioned Ambien, and I'll mention Xanax. I know people who've been involved with that stuff. And it's not good. It has a lot of long-term side effects that aren't any good.
Well, it's interesting you bring up Xanax. So Xanax, it doesn't make any sense to be a sleeping pill because it lasts about an hour. So how is it, though, that many people take it to go to sleep? So the answer is, if you're very stressed and you're very anxious and you don't have that ability to power down, so it's basically going to do that for you. It's a pharmacological power down, and then you can sleep. So it's not a sleeping pill. It's really an anxiety and stress pill, but it's because of that high level of anxiety that people are having. Because, stress and anxiety are terrible for sleep. And there's also this concept of stress about sleep. So insomnia begets insomnia. So let's say, okay, I've not been sleeping well. So we've all had the following experience. I've not slept well for a week. All I want to do is go to sleep. And I'm really tired and I get into bed and I get that feeling, oh, here it comes again, that I'm in bed and now I'm waking up because the bed, instead of I've mentally associated the bed with relaxation, I've now associated the bed with stress and anxiety. So, the bed should be this wonderful place that you go and you just go and relax the minute you feel good there. But But this, unfortunately, that's why it sort of begets itself. And this is where our behavioral sleep colleagues help us out a lot with this and trying to get people to have a more relaxed attitude about sleep. That don't worry, your body will get the sleep it needs. It will happen. It will happen. You can't make it do it. You can't mentally put yourself to sleep. It has to happen by itself.
Now, a little earlier, you started to give me your 516 number.
Yes.
Maybe it would be a good idea if you gave us your 516.
Perfect. You read my mind again, Otto. Yes. How can we get in touch with you, Dr. Huberfeld?
Okay. Best is to call our main office number. It's 516-326-0707. And I said our practice, I have a colleague, Dr. Sohal. She's my sleep colleague, and in addition to our pulmonary practice. We have an office in New Hyde Park. We have an office in Woodbury, an office in Howard Beach. I'm in the Howard Beach office as we speak. Thank you to Northwell for giving me these wonderful opportunities to branch out to the community.
Absolutely. Well, like I said, this is a topic we're constantly addressing here for all ages. Obviously we focus a lot on senior age,
Right.
issues, but this is something certainly that I think everyone, and has different relationships with. And it is, you touch upon it. It's so complicated, sleep, because it's really tied into habits and behaviors. And, so it becomes this convoluted thing. You don't know like how to unravel this ball, and I think, just doing these little steps, and certainly, making an appointment with you and getting yourself checked out is the first step to kind of wrapping your head around it.
Sometimes you need help to fix things.
Well, sometimes, you just need. I had an interesting conversation with someone yesterday about I was doing a follow-up telehealth of one of my sleep patients. And I'm not going to go into the specifics, but he says, I just needed someone to set me straight about my sleep.
Yeah.
He was doing everything wrong. It wasn't anything rocket science. I don't know if you needed a doctor. He just needed to talk to someone about his sleep, and it was fine. We had one visit, and now I would say 80% cured. I wish I was always that successful with everybody, but it was mostly common sense stuff. He was literally working on the computer during the night. He was drinking too much coffee. He wasn't giving himself enough time to sleep. And in 1 month of good habits, he's well on his way to better health.
And there was one thing I had read in an article, and I want to touch on before we wrap up. It was saying that you really shouldn't need to use an alarm to wake you up, because by using an alarm, and this was some article I'd read in some magazine, it was saying, by the mere fact of using an alarm, your body's not done resting, right? And I was like, is that true? Listen, I'm the queen. I need my alarm in the morning to wake me up, because I was like, it's that fear that I'll just keep going and going and going and not get up for work. So how does that, is that just...
Well, do you work 7 days a week?
No, 5 days.
Okay. What do you do on the weekends?
I do not set my alarm for the same time.
And what happens?
I wake up roughly around the same time.
Right. That's what happens. Most of us don't need the alarm to wake up. We need the alarm to get us out of bed.
Yeah.
If you're doing things right, you should be waking up about a minute before your alarm. The alarm is there as a backup.
Right.
The reality is the alarm is there to just make sure you don't oversleep. But you're right. You should be, if you're constantly waking up on your alarm, you're probably not getting enough sleep.
No, it's interesting.
Can you train your body to, listen, as I said, I'm not the best sleeper in the world, so I'm like average a 5 to 6 hour a night sleeper, right? And I feel like that's what I've trained my body. And, as you had touched upon earlier, I feel like if I sleep over that amount, I'm more tired. So is that just psychological, or is that something that like actually can happen? Like, I have trained my body all these years to only really sufficiently need, 6 hours of sleep, let's say.
Okay. You're going to answer how much coffee you're drinking?
I don't drink that much. I drink like one in the morning and like one, like, midday, night,
Okay.
evening.
Well, I think the answer is you can to an extent.
Mm-hmm.
So if we go back to what somebody said in the very beginning, which is that during a time before there were electric lights and schedules, people slept naturally more in the winter and less in the summer,
right,
which means that there was a range of what your body will need. So you might be able to an extent push yourself into on the lower end of what you can get away with.
Mm-hmm.
where at the point where it's probably, you might be a little tired, but not dangerous to your health. I think, but in general, I think we as a culture get too little sleep.
Yeah.
And I think, and I put myself in the same category, because we all have so much we want to do. Our lives are so interesting and so exciting, and there's so much happening all the time, and we want to do it all. We want to work. We want to be with our families. Good things. Good things. And these are not bad things. I'm not talking about the wasted time. These are all the good things we want to do. We want to, and we keep pushing, and we keep pushing. Some people can, and some people can't. I see people so often, and I know their simple problem is they're not getting enough sleep. And here's the counterpart of it. So they're so willing to do anything. They'll sleep with a CPAP machine for their sleep apnea when their real problem is they simply need more hours in the bed.
Yeah, I'm a big one on when you get the feeling of being overloaded, it's time to regroup, make a list, review the list, and prioritize. And it kind of cleans your brain out a little bit, and it brings you back to focusing on what you classify as the most important stuff to do. Because otherwise you get a list this long in your head. And
I know.
Sage advice.
Yeah.
That's right. That's words of wisdom. I think it's something we all could work on, but we are at the end of this segment. I cannot thank you enough, Dr. Huberfeld, for being on and really diving in with us. And we're certainly having you back because I know Otto and myself have tons of questions. So you can get in touch with Dr. Huberfeld at 516-326-0707. Thank you again. And everyone try and get some sleep.